So let me tell you a little bit about myself and how I became involved in this. As Mark indicated in his introduction, I am an attorney that represented older adults and people with disabilities directly in Wisconsin, where I graduated from law school. And I had a client that had retained me to help her with her power of attorney documents, a very common thing that when we get older we all will need to make sure that we have. It was a very inspiring client that I had. She had been a nurse all of her life and had retired and wanted to get her her issues in order in case anything happened to her. She had a daughter who cared for her part of the time, that she worked full time. So she hired a caregiver to care for her mother when she was at work. And then when she got off work, she came and took care of her. And then one day, I got a call in my office from the direct care worker describing my client in a way that clearly indicated to me that she was in the middle of a stroke. She indicated that she had difficulty talking, that she was stiff, and that she didn't know what to do. And I remember, I would always remember that call because I became very terrified. I am not a medical professional. I obviously not, I didn't. So I became very concerned that the direct care worker called me instead of calling 911. So I told her, hung up the phone, call 911, and then I went to my client's house because I couldn't, I was extremely concerned about whether she was getting, the care that she needed. And then after that experience, seeing my client taking it, to the emergency room and realizing the tragedy and irony of the situation, that I was representing this lady who had worked over 25 years of her professional life as a nurse, caring for other people, and that here she was at a moment when she needed help, and that she did not have the kind of support and help that she needed. So I became very interested in advocating for workforce issues at the time, in addition to older adults, because I realized that direct care workers were very burdened with a lot of responsibilities in caring for many different clients, that at the same time they themselves did not get the wages, the recognition, or the training that they deserve, and that they were incredibly committed, making personal sacrifices for their clients many, many times because of the love of the profession. Given the wages and the benefits that direct care workers receive, we all know that there are other jobs that are not as draining, that are not as difficult. If you look at the statistics, they bear witness to the personal stories that you hear across the country about what direct care workers go through. Direct care workers as a profession around the country are number 2 in experiencing the highest levels of depression in any other profession. They're also in the top 5 for back injuries and another type of musculoskeletal injuries like that. At the same time, you realize that there is a crisis around the country when it comes to long-term care. Baby boomers are reaching the age of 65 at the rate of 5,000 a day from now on into the foreseeable future in the next decade or 2. Therefore, the demand for direct care will double in the next few years, and we are not prepared currently to meet that demand. The only way we're going to meet that demand is that we have enough direct care workers that are well-trained, that are well-respected and valued in order to care for our loved ones. And it's something that we want to do for ourselves, right? We all age, and we want to have the peace of mind that when we get older, or our parents, our grandparents, or our loved one needs care, that there will be a qualified direct care worker that will be accessible, well-trained, and respected, so that we can make sure that our loved ones get the care they deserve, and that they lead as independent a life as possible. So I love and I really appreciate opportunities like this when I can come and talk to people about this really important issue, so that we can all work together to improve the working conditions of direct care workers. I am really proud of Mark and the New Mexico Caregiver Coalition for their commitment to the issue by organizing this conference. And I hope to come next year and the year after, either as a member or come to talk to you again about what's going on in long-term care. But we all need to come together and support direct care workers, because we need to raise the consciousness of every American to pay attention to this issue in the way that they currently are. We need, basically, this is a movement for change, a movement to keep the promise to our parents that we will care for them the way they care for us, that we will have a qualified, well-trained direct care workforce in order to care for them. So what are the things that we need to do to make this happen? Direct care work is one of the lowest paid jobs around the country. And as I mentioned earlier, one of the professions that have very little support in terms of workforce development, career advancement opportunities. Every state has different requirements for direct care workers. There's no national standards for the profession. And we need these jobs in order for there to be an available direct care worker for every older American when they need it. There needs to be many, many more direct care workers. It is projected that the profession is currently at 3 million jobs in the country right now, and we need at least another 1 million direct care workers in the next few years. Where are they going to come from? If you look at the statistics, the demographics of where the direct care workers come from is shrinking. The overreturn rate in some places is as high as 100% or over 100%. And we all know why. You get people that are really committed to doing this work. They're willing to do it for because they really genuinely care about caring for other human beings. It's a really highly rewarding work. But it's not well paid, and there's not enough training and education. In addition, as I mentioned, the statistics, the burnout is very high. Those are the reasons for the high turnover. So we need policies that will promote this workforce as a high-road profession that many, many Americans will want to enter the profession. And at a time when our economy needs job creation, this is the sector that our policymakers, our governors, our elected officials at the state level, and our national leaders need to see as a job development, as an economic growth opportunity for our states and our country. These are jobs that are not exportable. People are going to need to get the care and supports that they need. Therefore, we need to make sure that each one of us take it upon ourselves to be advocates and educators, to talk to policymakers and say, let's do something about this profession. We at the national level, have 2 major initiatives that I mentioned earlier. We have a Training and Education Voices Institute every year to support the leadership development of direct care workers in their states, and Mark and Alex, who's here, are graduates of that program, and I am so glad to see them here. But we want to graduate many, many, many more. We also have, we're supporting a legislation that Congresswoman Sanchez from California has put forward in Congress. It's the Direct Care Workforce Empowerment Act. It has 3 essential components that are really important to create a base that we can build from. It will establish minimum wage protections for direct care workers. It also will establish grant programs for the states so that they can build training and education and career advancement opportunities for direct care workers. And it has data gathering so that we can learn more about how we can support the direct care workforce. We need the support of New Mexico for that legislation. So I would like every one of you to give us your phone number or go on our website www.directcarealliance.org, and sign up for our e-news and go to our Legislative Action Center, where you can directly learn about this and send information to your elected officials, and you can print it out information that you can use to talk to other people here in New Mexico. We do a lot of coalition building in education around the country by meeting with other stakeholders such as ARP, family caregivers. This is an issue that impacts every American. And so we see it as our job to go to conferences like this, but also meeting with other organizations at the national level. And we have something called the National Direct Care Partnership, where we bring other organizations together on a regular basis to talk about how we're going to support this, direct care, this workforce. And then our credentialing program, which is a really innovative and really cutting-edge, important initiative. The Direct Care Alliance is the only organization taking this issue on. That we're creating a national credentialing program for direct care workers that work in the home and community. We want to, it has been developed with standards by the Institute on Credentialing Excellence. It has been in development for over a year. We have held focus groups around the country with direct care workers, with older adults, people with disabilities, and employers, so that we have the input of every stakeholder in the building of this program. We're going to launch it early next year. The evaluation and validation has just been completed. We're going to post our report on our website in our online e-news pretty soon. And it is the beginning of professionalizing the workforce.